Congresswoman Schultz, good to have you here today. Welcome. What about that question? We hear the president all the time say that it's going to be deficit neutral, that this whole health care program in the end will not add anything to the deficit because we're going to find all of these things that are expenses that need to be cut, that's wasteful. And as this man says, well, if that's true and we know what all this waste is, why aren't we already working on getting rid of it?
Well, we have been working on getting rid of it, but, to be quite honest with you, not in a significant, comprehensive way. I mean, in the last number of years, particularly during the Bush administration, there was no concerted effort whatsoever to address health care reform or the waste, fraud, and abuse in Medicaid and Medicare. And, unfortunately, in South Florida, my own community is a hotbed for waste, fraud, and abuse, and included in health care reform, we're going to be making huge, significant inroads on addressing waste, fraud, and abuse, and particularly getting a handle on overall health care costs.
You know what, Congresswoman, with all due respect, I think people listen to that, and I think people say you're right. Nobody has attacked the issue of waste in the budget the way that it needs to be done. But now we're hearing that there is $200, $300 billion, $400, $500 billion, depending on whether you're looking at the House bill or the Senate bill, that's going to be cut. It's going to be magically erased from all the expenditures that go into health care, Medicaid, Medicare, and that's magically how we're going to pay for this health care bill. And frankly, people just don't buy it. Lay out for me, where the heck is this money coming from?
Well, I'm not sure which people you're talking to. Plenty of the people that I speak to are buying it. They're excited about the possibility of significant health care reform. We're going to shift from a sick care system to a prevention-based system. And just by way of example, for every dollar that we save in prevention for a diabetes patient, for example, we save $7 in overall health care costs to take care of that patient. The Medicare Advantage program, only 14 cents of a dollar goes to actually providing benefits to Medicare beneficiaries. 86 cents goes to the bottom line profits of the Medicare health care insurance companies.
All right, so wait a minute.
Shifting our focus
those are two different things that you're talking about. Well, I just want to go back to the first thing you said because there's a lot of information here. So the first thing that you're saying is that if you give preventative care, you're going to save money in the future. I think that's a logical thing that everybody can get their head around. If you do things first,
it's hard to put a number on it.
It's very hard. In fact, the CBO says it's impossible to score that kind of savings. But I think that's something everybody can get behind. But that is just such a small portion of this huge nut that needs to be. And what we're hearing is that cutting out waste.
It's not a small portion.
Cutting out waste. What you're talking about in preventative is not cutting out waste. So show me, where's the savings? Where does the money get cut out from Medicare and Medicaid, and nobody gets hurt, doctors don't get, reimbursed less? Where does it come from specifically?
With all due respect to you, it is a huge portion of the waste. When you have, constantly patients being readmitted repeatedly for unnecessary hospital visits that had they been taken care of up front, then we are adding to the waste and the cost of our healthcare system by adding unnecessary healthcare expenses that could have been addressed by simple preventative care up front. We're going to make sure that we go after people, the literally billions of dollars in fraud and waste that occur in the Medicare and Medicaid system. Those have never been systematically and comprehensively addressed, and now in this legislation they will be. On top of that, we're going to be capping the overall annual and individual benefits, overall individual limits that insurance companies charge now.
I hear what
Medicare. Medicare beneficiaries. No, let me just finish my answer, please.
Go ahead.
Medicare beneficiaries are going to see their costs reduced because they each pay additional $43 a year, $43 a month in Medicare premiums just to cover the Medicare Advantage recipients who aren't even getting the benefits that they deserve. So we're going to get individual savings and overall savings. If all that preventative medicine
pays off and it cuts costs there, I don't think you're going to find one person who would disagree with that as a motive here.
But also
talk to me a little bit about the fact that there's going to be reimbursements will be cut back to doctors, to hospitals. When that happens, when you cut back the reimbursements that are getting paid to doctors and hospitals, how do you do that and not lower the quality of care somewhat?
Well, the reimbursements that are going to be cut back are going to be like the unnecessary hospital readmissions and that I was referring to a minute ago. You have so many. I represent thousands and thousands of senior citizens who spend half their life in the hospital, it seems like, and a lot of those readmissions are because the hospital didn't take care of the problem that they had when they first went in. So making sure that we focus on prevention and then also addressing the health care problems when the people are in the hospital will allow us to to reduce the amount of reimbursement,
there's
but
a number of
also
ways
we're
to
going
get
to
there,
cover more
Congresswoman,
people.
and I think a lot of people would like to see it happen through real, honest competition between these hospitals, and then the ones who do it the most effectively win. But, this is a debate you and I are having, and it's happening all across the country. So we thank you very much, Congresswoman, for being here today.
Thank you.